welcome, welcome. Hello, everyone, and happy Tuesday. Welcome to our faculty webinar today. I'm so excited to be talking with Rachel Taylor and Dr. Hicks about this topic that's really important to us. We're going to be talking about diversity in our learners and how can we meet our learners where they are. So this is a really important topic because diversity can look in a lot of different ways, and we'll talk about that today. So my name is Hiva Kolodrobitz. For those of you who don't know me, I am a APRN. I'm a family nurse practitioner. I've been an NP now for a decade. And I've just gotten into nursing education, specifically NP education, in this last year and a half. And the landscape, I was really surprised how much the landscape has changed since I went to school. So I've really gone deep into the evidence, and I really want to talk to you guys about that today. So I'm excited to get into it. Before we get any further, I want to just let you know that we are accredited by ANCC, so American Nurses Credentialing Center. So you are eligible to get a contact hour for this free webinar, which is great if you choose to attend at least 80% of the webinar today. And myself and the other presenters, we have no financial relationships or commercial interest in anything that we're presenting to you today. These are just resources that we've used and we have found to be evidence-based, and we really want to provide them to you to help ease your burden as a faculty member to really help reach your students. So learning objectives, big three things that we're going to talk about. We're really going to talk about why we should care about diversity in our student population. So let's discuss what that diversity looks like and what the impact is on the students' learning. And then we're also going to talk about those evidence-based strategies that I mentioned. So we really want to give you something to walk away with that you can apply today in your classroom for your students today. And then we're going to talk about that faculty support, what that looks like in terms of communication, flexibility, mentorship. So we'll get into that as well. But big three learning objectives. All right, without further ado, our lovely Rachel Taylor is going to kick us off with understanding the landscape of today's learners.
Welcome, everyone. So my name is Rachel Taylor. For those of you who haven't met me, I know I've met a few of you on the call before, but I'm our Director of Nursing Services. So really, from when students are trying to get into nursing school all the way through that new grad period is really where my area of expertise lies. But I started off in an ICU, eventually found my way to education, and I've been in education for over 4 years now, just shy of 5 years. But I really want to start by grounding ourselves in the educational landscape. Nursing and allied health, all of that, it's no longer a one size kind of fits all experience. Our students come from a very diverse background, and they bring in different expectations into the classroom. They're digital natives, they're balancing work, they maybe have family commitments, and they're entering programs with a wide range of experiences. So as faculty, it's really critical that we understand what do today's learners look like so that we can really effectively support their success. So through this session, we're really going to explore diversity a little bit further. So the face of nursing education is changing. Over 40% of the US population is composed of people of color, and by 2045, the nation is projected to be majority minority. Yet, if we look at our RN workforce, and this was really the big thing that I found interesting in my research, was only about 19% identify as minorities and fewer than 6% are Hispanic. So we have a major gap in diversity in our nursing workforce. Male nurses are also underrepresented at about 10%. So typically less than 10% of nurses are going to be males. Interestingly, our student population is a little more diverse though. Around 40% identify as minority students, and about 12% are going to be male. So we're seeing more and more diversity come in through our students. So why this matters is we have to understand where is the diversity coming from and how can we meet the needs of our diverse students. And so what's really kind of important that I found in my research as well is that minority nurses are more likely to pursue an advanced degree than if we were just to look at white nurses and their white peers. So it signals this really big drive for they want this professional growth. And with this diversity also comes varied learning. There's different preferences by age, by culture, by socioeconomic background. And so, as faculty, how can we be intentional in how we are going to design our curriculums and our learning experiences that are going to meet this wide spectrum of needs? We can go to that next slide, Hiba. So, while student populations are becoming more diverse, our faculty demographics, they really truly have not caught up. Only 19% of full-time nursing faculty are from minority backgrounds, and only 7% are males. And so this disconnect means students don't see themselves represented in their instructors. And I don't know about you, but I know when I think of my own nursing school experience, I found an instructor I related to. And when I related to them, we connected a lot better. So I had a baby in nursing school. The joke when I was in school was there's always one in every class that's going to have a baby. It was me. And I actually had an instructor who had a baby in nursing school. Like, what are the odds? And I really connected and related. And so sometimes it's finding like, hey, how do we see ourselves in our instructors? And the reason why representation matters so much is yes, it fosters inclusivity, but it also is going to help prepare nurses for diverse populations. Like if you think of the patients that they're going to see, they're coming from diverse backgrounds. We want them to have experience with individuals from diverse patient populations. And so when we have faculty diversity, it's going to enrich the classroom because it brings those different perspectives in, and it really allows for more life experiences where I feel like our students grow a lot more from hearing those life experiences that faculty have gone through. And so what we really need to be thinking about is how do we recruit and retain diverse faculty members if we want our institutions to reflect both the students we teach as well as the communities that we're going to be out serving and teaching these students to go serve. And so this is an area where academic leaders and faculty can really advocate for change. So when we look at the generational differences in the classroom, we can see that there's a lot of diversity here and how people learn. My favorite is when I'm working with students today or I do a LinkedIn post, people will be like, well, that's not how it was when I was in nursing school. Why are we doing it like that now? I could have never done that when I was in school. And we've maybe thought that ourselves. I know I have from time to time. And so it's because there's a huge difference in the classroom and what it looks like. So we have our baby boomers, we have our Gen X, our millennials, and our Gen Zs. So all kind of varying here, but each generation values different things. So when we think about baby boomers, they often are going to emphasize discipline and loyalty, and they really prefer face-to-face communication or email. But then we get to our Gen X, and they really want independence. They really want efficiency. And so when we think about that, they're going to communicate a little bit differently. And then we get to our millennials. They really love teamwork. They like feedback. They like growing, but they want digital first when it comes to communication. They don't want someone to have face-to-face communication. They're like, send that to me in a text, right? So it looks a little different. And then we get to the Gen Z, and they're really the most diverse generation yet, who expect fast-paced visual technology integrated learning. They want it quick, they want it easy, get me what I need to know and let me get out the door type of learners. They grew up understanding everything there is about technology. And so it's not just like oh, this extra tech is a perk. It's like, this is the expectation of how I am to learn. And as faculty, it can be hard to balance, right? Because we might have people in one class who fall into all of these age ranges, maybe not as many baby boomers, but I have had a couple. And so it can be hard of how do we balance this in the classroom? And really it's offering, the multiple modes of communication. It's offering different types of teaching strategies to create a learning environment where it doesn't matter if we have someone from Gen X or Gen Z, they can still thrive in that learning environment. And if we go to different challenges that are faced by students, and when we think about the growing diversity and generational strengths, there's challenges still faced. I know some people will say nursing school is so much easier now than it used to be. But yet we're seeing that 74% of students are feeling emotionally exhausted 71% feel depersonalized, and 76% feel a low sense of personal accomplishment while they're in nursing school. Nursing school is a massive achievement, and anyone who's going through it should feel like they're doing amazing things, but yet they're not. And so these numbers are really alarming to me. And when we think about it, right, there's some reasons why. There's intense workloads. They have, heavy study requirements. Sometimes they're balancing a lot of things, a job, personal responsibilities, and it can take a toll on their mental, physical, and emotional health. So for us as faculty, just being aware of these challenges so that we can make sure that we introduce support systems early on semester one, so that we're making sure that we integrate strategies to help support these students to thrive and not just to go through it with experiencing these high levels of burnout. So that way we're not just improving performance through school, but we're teaching them these things so that it protects them as new nurses, so that they have these skills when they become a new nurse, so that they have a successful early career as a new grad. And then lastly, the faculty nursing student relationship. Relationships are so important. If you think of your own life, I just want you to think about how much relationships have impacted them. And one of the big ones are faculty and nursing student relationships. So this can really make or break a student's experience. Positive faculty student relationships, they build confidence, they're going to increase motivation, and they support academic and clinical success. So students who feel supported and really importantly respected are more likely to engage in the classroom and to persist through challenges. On the other hand, they found that when there was poor faculty student relationships, what happened was they weren't able to make it through those challenges. They felt incivility, there was rigid teaching, they had a lack of communication, and then it led to where the student was feeling more stress, they were disengaged, and both faculty and students had burnout. So barriers like institutional workload pressures, maybe faculty burnout, they are very, very real. And so what we can do is we can use facilitators like mentorship, timely feedback, accessibility, effective use of technology to try to help bridge the gap. Because our role as faculty, it's not just to teach content, but we have to model things like professionalism, respect, empathy. What do we do when we start to burn out? Because if that's happening to us as faculty, how do we model that to our students so they can see how to respond in those situations? Because those relationships are really going to be the foundation for student growth and ultimately for our client care outcomes.
Well said, Rachel. That was really well said. I love that you laid the foundation. I think a lot of us can identify with the points that you made, both as faculty and just thinking back about on our training and what we went through as nurses, to become advanced practice nurses, wherever we are in our nursing journey. And we want to do it differently as faculty, right? We want to make sure we change that landscape and we adopt these practical approaches. So let's talk about some practical approaches for these diverse learners that Rachel just laid out for us. So we see now it's not just one bucket. We really have diverse learners in age, generation, technology, comfort with whether they want to use quick videos or get the lectures in writing. I know I struggle with that a lot with our younger generation who really aren't really looking for text that they're going to read. They want those quick bite-sized videos. And I struggle with that as a faculty member teaching that because for me, I like to dive deep into the material. I'm right on the cusp of millennial and Gen X. So I like to dive deep into the material before class and then really be able to participate. So we really have to think about how all our learners are engaging in our classroom. So active learning, what is active learning? It's really going to help us have that engagement, whether we're talking about an in-person, online, or hybrid platform. So making sure that we're getting our students to engage in the lecture as opposed to having that formal lecture heavy format, which is what used to be the case. That leads to a lot of disengagement, both for our older students and our younger students. We're really seeing it across the different generations. So older students, they're typically more higher engagement with our older students, and they typically have higher completion rates. And our younger students really like that structure that Rachel was talking about. So they want that active learning, but they want more tech incorporated. So let's talk about some of those strategies. So audience response systems. I know we were starting to do this about 10 years ago with clickers and polling, but what does it really look like now? The research is showing that if we're practicing those board style questions while we're learning the material, then it's going to be embedded. Those students are going to understand that material so much better. So, doing those board style practice questions as we're learning the material, as opposed to waiting to the end, is really a lot more effective when you're learning the information. So, using those board style questions in class, whether it's asynchronous or synchronous teaching, to get those students to really be focusing on the content, identifying those knowledge gaps, and really filling in those knowledge gaps with these board style questions. It provides instant feedback to them. They can go back and read the rationales, go back and dive deeper if they want to, watch videos, and it also allows faculty to really clear up any misunderstanding on the spot so students really don't have misinformation and remember misinformation. So it really works well both in person and those online settings. Simulation activities. I think as faculty, we're hearing a lot about simulation, and it's challenging to think about, well, how can I use simulation in which platform, right? And we'll talk about that in a few slides. But simulation, we find that high fidelity simulation really allows students to engage and help make those decisions in the moment in a safe space and feel confident about those clinical decisions before they actually enter clinical practice. So when we're talking about clinical based evidence and really getting them prepared, not just for the exam, but entering clinical practice, those simulations, we really need to work on getting those simulations high fidelity and helping students really engage in that role play so that they can feel confident stepping into practice. And then flipped classrooms, I really liked this strategy. I think it's really effective to flip the classroom model. So, what do we talk about when we say flip the classroom model? Remember, Rachel talked about some of the learners. They want to be able to sit with that information. So, our older learners want to have the information ahead of time before class, read it self-paced, and then come into class and really engage in conversation. So, that's really what a flipped classroom is. So you assign that content before class, whether it's reading, videos. You do want to assign it in different formats for those different generations. Some may choose to prepare before class, some may choose to get the cliff notes or the highlights after class, depending on their generation. But really, what's expected during class time is not that lecture heavy format, but really more of a discussion, engagement, case-based scenarios. This is linked to higher exam scores, and it really helps our students deeply understand the material as opposed to just memorize and go. It also appeals to our tech savvy younger students who like to have things, again, structured but quick and tech savvy. And it also appeals to our older students who like to sit with the material and study it on their own time. So it really gives that student body the time to digest the material on their own terms and then come into the classroom and engage with their peers. Key takeaway, these active learning strategies really benefit everyone, no matter the generation or age. So let's talk about supporting those diverse and first generation students. So research really shows that our first generation students, if we come at it with a targeted approach, that can make a huge difference. So if we really reach out to our first generation students and provide tutoring, provide mentoring, research shows that they perform 12% higher than their peers who didn't get that mentorship, who didn't get that tutoring, one-on-one tutoring. And I see it in my students every day. Those low income students also improved their grades about 14%. That's pretty significant. So, as Rachel mentioned, students come to us with a lot of different barriers, right? It could be that they have financial strain, they have competing obligations, family, school, work. They may have come from a weaker academic background. So I do that a lot with my students. I really talk about studying strategies and building that foundation so that they can understand the material that they're learning. So I see that even in my advanced practice student population. So, really thinking about those barriers and meeting students where they're at and reaching out and making sure we're making everybody feel included and creating that inclusive classroom environment is really going to help these students and reaching out and really making sure that they understand that you're willing to mentor them, tutor them, whatever they need to help them succeed. That's really important. So, when we're talking about case studies, one thing that I really enjoy is making sure you're taking real case studies, real clinical case studies. You've obviously changed the patient demographics so that for HIPAA reasons, we are keeping confidentiality, but you're presenting them with real case scenarios so that they understand our patient population is diverse. Let's think about all the different ways that we may see patients walking into our practice and how we're going to be flexible and treat those patients in a culturally sensitive way. So that's really important. Also, for our students, think about all the different ways that they join. So, on these online platforms, these hybrid courses, students might be all over the country or all over the world. So, they're on different time zones. So, we really want to be flexible with what we offer to make them feel like we are there, we are present, and approachable. So, flexible office hours, flexible and frequent in-person synchronous meetings. Those are really important to make people feel like, okay, this person is reachable when I need them, when I'm struggling. And then always providing respectful but supportive feedback. We'll talk a little bit about what that means, but you want to make sure that you're not just focusing on their grade, but you're focusing on, well, this is what you do well, and these are actionable items that we can use to improve your clinical skills. So you want to give them real feedback, supportive feedback that they can apply and work on. But we need institutional support, right? So I hear a lot from our faculty too, the burnout with faculty. We can't do it alone, but we can definitely drive these things within our own institution. So we obviously can't affect the financial aid offerings in our institution, but we can encourage our administration to really start a peer mentoring program or talk about doing information sessions at different times so that those with families and competing obligations can also join. We can also support our students by helping them research different scholarships and grants that they could apply for to really help them with those financial strains of education. So there are things that we can do to help our institutions support both us and our students. The one thing that really struck me with online versus hybrid learning, so one thing that I was not as comfortable with when I started going into education and started to teach my NP students was the online and hybrid learning. So COVID really changed this landscape. And I thought, oh my goodness, how are students meant to learn nursing, advanced practice skills online? This is crazy. But then I started to dig deeper into it, and the evidence shows that there's actually no significant difference between in-person, online, or hybrid. Hybrid seems to be the best of both worlds. But the deciding factor is the level of engagement. So the students don't actually have to be in person, but they have to feel that level of engagement when you're teaching online and when you're teaching remote. Hybrid learners tend to have a strong sense of belonging, I think, because they do have those checkpoints where they can come in, see faculty, engage with faculty. Our online learners sometimes feel disconnected, especially if we do a lot of asynchronous check-ins in work. I see a lot with my students that they don't have a community of other nursing students. And that's really tough because I'm sure you all remember your nursing education and training. I could not have gotten through my training without my peers. We studied together, we cried together, we celebrated together. Having that sense of community is crucial, but we as faculty can build that for our online learners. So engagement is really heavily dependent on how present we are as faculty members, how much we engage, we interact, and encourage that engagement interaction among our students. So this is really, really important for us to adopt and also demonstrate and model. So some best practices really working in those active learning tools just to mimic that in-person learning environment that we talked about. So that flipped classroom is something that I really enjoy. But you can start to incorporate that into your curriculum. Also, talking about those synchronous sessions. So, yes, we get learners from all over the world sometimes, but incorporating a few synchronous sessions is really important for students to see each other, feel like they have a community, feel like they have peers, and be able to really engage with faculty is really important. And then ensuring that strong faculty presence, that's you. So you really want to make sure that they know you're accessible, you can reach out to them, especially those struggling students. And then promoting that peer learning. So that's why that flipped classroom is nice too, doing breakout rooms, really getting the students to engage with one another and form a peer relationship. VR, virtual simulation, is something that PTSD, we really need to be thinking about all these tech tools and how they're going to help train our next generation of nurses and clinicians because there's a lot of possibility there. So keep an eye out for that. And then we're going to talk about that faculty development. So again, a lot of this is new for a lot of us, right? Virtual education is permanent. We thought with COVID, okay, we'll go back to in person one day. This is temporary. But we're seeing that this is not going away. This is permanent. We have to adapt. We have to really make sure that we're meeting our students where they're at and we can really get the training that we need as educators to be able to help our students succeed and be ready for practice, not just for the board. So, adopting some of these principles is going to go a long way, and really continuing to do research is going to be critical. So the fact that you guys are here today is wonderful. There are also some other frameworks that I won't go too deep into, but I'll mention here today and you guys can go and explore it. But Quality Matters has a really nice online course design for helping faculty design those online and hybrid courses. And you can adapt it to your particular subject and class that you want to teach or you are teaching. Novel also has a podcast, so they do have a ebook on a step-by-step guide to developing simulations. So for those who are thinking about, okay, let's try to do something within my department, within my coursework with simulation, they really have a step-by-step guide, and the podcast is something that you can listen to as opposed to getting the ebook, which goes through all those steps too. But really thinking about being mindful of our students, working with them on their work schedules, being flexible, providing different formats for accessibility, really encouraging our students, encouraging other faculty to adopt these different strategies is going to go a long way in helping support our students. And key takeaways to think about, it's not a one size fits all approach. So we really have to be flexible, thinking about how can we engage our learners actively to help them improve not only their exam scores, but their confidence. So oftentimes I see really high performers who are just not confident in entering clinical practice. So how can we improve that confidence through these active learning strategies? And then retention. We want to keep our nurses in the workforce, right? We're about to come up to a huge shortage, and we really want to make sure that we keep our nurses in the workforce. So retaining our nurses, and that's going to really be about creating that supportive environment. So tutoring, mentoring, reaching out to your students, especially those students who are more at risk, like your first generation students, minority students, and then designing those programs that are really going to fit across all the different generations and age groups. Biggest things, steps to apply today that you can apply to your coursework. So when you're providing lessons, provide in two different formats. So video format for our younger generation and PDF handout for our older generation. I know I would appreciate both. And then also using one of those active learning strategies per class that we talked about today. And then something as simple as really adding captions and transcripts to the media so we can make sure that everyone feels included are going to be huge. But don't be afraid of that student feedback. We really want to make sure we give them meaningful feedback and help them take actionable steps, and really emphasize the learning outcomes.
All right. Great information so far. So this is so exciting. So just a reminder, I'm Dr. Tracy Hicks. I love academia and building, making sure we produce good leaders. This information that I'm going to talk about, digging a little bit more into it, is building bridges across generations. Okay. So our call as educators is to meet our students where they are, right? And we have to take care of ourselves too while we do that. So let's dig into it. So lots of good information. So when we're talking about recognizing communication preferences, so we touched on this earlier with Rachel's kicking us off, but let's look at this. So it's funny for me, I kind of cross across all of these things, and I don't tend to put myself in a box, but we are in those boxes, and some we're going to relate heavily in each of these different topics. So let's talk about our boomers, for instance. So one of the most notable generational differences is communications, right? So how we communicate, how we take in information. So if we think about boomers and Generation X, they may prefer that formal email or face to face, right? So they have to get used to and adapt to this new online or hybrid education. Then our millennials, they're digital first. They like that collaboration. They want to know what you're thinking, right? I have people picking my students picking my brain all the time. Tell me more about that, Dr. Hicks. What do you think about that? So be ready for that. And then our Gen Z, okay, can we text you? Or they want that real conversation. They want to get into it. I had someone call me auntie the other day. I was like, okay, whoa. But again, just meeting people where they are, that's something that we must do. Okay, so let's talk about what is our faculty role, right? So just what I mentioned, you yeah, there we go. So flexing style without losing professionalism, right? So when that student called me auntie, right, because that's something new that they use, especially in our Gen Z population, that's an older person, right? I had to say, oh, wait a minute, let's keep it a professional. I've heard that before, but just being, not taking offense to it, but really leaning into it, right? And one of my favorite things is emotional intelligence, right? We have to have that social awareness and the empathy piece that help to build that trust and engagement. So important. And then, of course, we have to look at our essentials, right? How do those come into play? Namely, essential and domain 6, right? It emphasizes communication as a core of competency. But then also our as domains 9 and 10, we get into the professional development, personal and professional development. So we have to think about those too. Next slide, please. All right. So motivating students across generations, lots of fun. So how do we motivate, right? So when we think about our boomers, right, there are different values when we want to drive that engagement piece. So again, not putting people into box, but using this information to consider what might the student or faculty be thinking. So boomers, duty, discipline, right? Chop, chop, let's get it done. Gen X, independence. They want work-life balance. I learned something from my daughter. She's 31 and she says, I want a job where I don't have to work weekends. Well, as I guess I'm a Gen X, right? Uh, but I'm thinking, well, girl, get you a job and if you have to work weekends, but then I thought, she has it right. If that's what she wants, if that's what's going to give her a work-life balance, we can't look at that and say, oh, that's horrible, right? So again, meeting people where they are. Then we talked about this earlier, millennials, collaboration and purpose. Our Gen Z, that what is our keyword? Innovation, flexibility. Those are things that we have to consider. So what is our strategy, right? Connecting those personal values to professional nursing, like the ethics, professionalism, and lifelong learning, understanding that we're going to learn continually. If you're in this academic learning space, we never know all it is to know. We're going to be continually learning. Okay. And then emotional intelligence. Eva and Rachel know that's my favorite thing to talk about. Emotional intelligence takes you a long way because there's difficult times in academia. We all know that as a faculty and as a student. So when we go back to our motivation, our ability to regulate our emotions, social awareness, empathy, All those things help us deal with sometimes things, situations that can be volatile, right? Because it's not easy in academia, and we have to understand that. So we want to embed emotional intelligence and leadership concepts into the curriculum and faculty development. And I've experienced how that can work, and the students really appreciate that. Next slide, please. All right, so navigating generational conflict. This is a lot of fun. So we realize again that volatile situation that I've read, and that's a strong word, volatile, because sometimes things can get volatile. But how do we manage that? We have crucial and difficult conversations. Okay. These are often necessary. So when we talk about the conflicts that may arise from differing expectations, we think about our older students. They see informality as disrespect, right? So if you use some slang or some of the things that students may use, that might be offensive both ways. So if you have a younger faculty and vice versa, or older faculty, we have to think about those things. And that's when that empathy comes into place, right? Understanding another's perspective, that social awareness and emotional regulation. So then our younger students, they view hierarchies as outdated. Okay. I'm the boss of me. Okay. But again, teaching that respect, and it's a balance. So we have crucial conversations. So this is what I see, and this is how that can play out professionally. So while I'm recognizing that's their thought process, I can have a conversation with them and say, this is how this might play out in the professional setting. And then what can we do as faculty? We can turn misunderstandings into teachable moments. Okay. Yes, there's going to be a misunderstanding that occurs. For example, I have a student who's planning a wedding. And so instead of me saying, oh my gosh, you're in the crux of your semester, you're planning a wedding, that's what she chose to do. So we had a conversation on preparation, being proactive with assignments, and not just saying, oh my gosh, I can't believe she's planning a wedding. Students want work-life balance. They want to be able to live their lives while getting their education. But bringing that professional piece back into the fold is very important. Okay, so you're planning that wedding or you're planning that vacation. What are you willing to do to make sure you don't fall behind in your assignment? So we're not getting a phone call and say you're going to be late on assignment XYZ. Okay. And then emotional intelligence, of course, reminding you again of self-regulation, relationship management. I just gave you an example of how that can occur. And then helping the faculty model respectful dialogue. So that emotional intelligence can do that. Okay, it can help you with that respectful dialogue. It can help you take a pause, right? Should that be said? Should that be said right now? And should that be said by me? Okay. And again, reminding you of the AACN Essential Domain 6, which conflict resolution, accountability, and integrity is emphasized. Okay. Next slide, please. So mentorship and faculty self-reflection. I mean, mentorship, it bridges generational gaps by modeling professionalism, resilience, and growth. So when we look at the essentials domain, specifically domain 9 and 10, we're looking at that professional and leadership development, right? How do they show up professionally? It's so important. And then the faculty role model adaptability. Students see learning never stops. And I let them know that. I say, look, I am committed to be a lifelong learner. I have credentials beside my name, as my kids say, the alphabet soup. But again, I'm dedicated to lifelong learning. And if I don't know, I'm going to let you know that I don't know. And we're going to talk about that. Okay. And being okay with you don't know everything. I had a student, I gave them a humanized approach of myself. I share some personal information. I have a daughter who has serious mental illness. I teach in the psych program. And that student said, that helped me really to humanize you because I thought, they see us as perfect. They see us as knowing everything. We have all the information. And if we let them see us that way, that produces burnout within us. Okay. So we have to create a space of psychological safety. And then again, bringing it back to those EI skills, self-awareness and empathy, they help to maintain rigor while supporting diverse learners. Okay. So you're going to meet them where they are. We're going to be people focused, but we also have to maintain that rigor. And sometimes that can be a questionable balance, right? How do I do that? How am I flexible or agile? And how do I respect diverse learners, but also provide them with rigor? I've heard faculty say, okay, we let them get by with too much. But again, taking it back to that example that I said about the wedding, okay, this is something that you told me. How are we going to manage that this semester? Okay, how are you going to be proactive? I respect that you chose to do your wedding, but how are we going to manage that? Okay, and then reflecting on that. Adapting doesn't mean lowering standards but confronting our biases, right? Because as a boomer, you might think that, oh my gosh, she's planning a wedding during the semester. But you've got to have that conversation. You've got to bring it to them, a psychological safe space, and have that conversation. Okay, here's your plan. This is what you said. How are we going to manage that? Okay, next slide, please. So, key takeaways building bridges across generations. Again, person centered approach, meeting people where they are, we have to adapt our communication. We have to respect those generational differences and preferences while also maintaining professionalism. And again, we're not saying that's an easy balance, but it's doable. Again, bringing it back to that emotional intelligence, which is so important. You want to motivate through values, connect those personal values to nursing values. Okay. I shared that I have this, I teach in the psych program. I shared a personal story. I share personal stories from clinical practice so the students can relate to those things and they see my values and how I feel about a certain thing. Not that it's going to match perfectly, but again, they can humanize us as faculty or as educators. And then address conflict constructively. Okay. Again, my favorite thing, model emotional intelligence in crucial conversations. They're not always comfortable. And if you're ever in a twit or a situation, you always want to remain curious, okay? Ask questions. If there's an uncomfortable situation, stay away from the you approach. Tell me more about that. This is what I understood you to say. Help me understand that. And then mentorship matters. You want to bridge those gaps. You want to foster resilience. And that's how we develop great leaders, okay? Leadership is not a position. It is a behavior, okay? So when we use all these great things and tips that we've learned today, I can tell you we're going to develop great leaders, whether you have a leadership position or you're a leader in your profession, okay? That's what we want to develop. We want you to be good, competent, and great leaders. We want our students to be good, competent, and great leaders. And then faculty reflection is so important. Balancing flexibility with rigor, we talked about that. We don't want to lose the rigor, but we also want to have those crucial conversations to make sure that we get that rigor and we maintain that. And challenging our biases. Remember the example I gave? I just want to remind you of that. You may not, in your age group, plan a wedding in the middle of semester, but you have a student that will. So what is the plan for that? And then we're going to maintain those standards while having those crucial conversations.
Thank
All
you so
right.
much, Dr. Hicks. And now we have our panel discussion. So it's open to you guys, faculty, to ask us any questions you have. One thing that Dr. Hicks I've learned from you is really remain curious. And I sometimes will find myself in conflict in life, mostly with my young children. And I just keep thinking, remain curious. And I think we can apply that to all phases of life. And it's really helpful when you remain curious because it helps you not come at the conflict in an aggressive way. And Rachel, I think you said something similar to me one time. It may not be the way we would do it, but we have to respect the process. And so I think a lot of times as educators, we get really frustrated. As educators, as nurses, clinicians, we get really frustrated with admin. And we just have to be respectful that this is what has been decided. I am not in the room deciding these things. It's not the way I would do it, like integrating these hybrid courses or online courses, especially for those older generations who really miss the in-person teaching. But we have to adapt and we have to remain curious. So I love that. First question that I'm getting from students. And again, you guys can, sorry, not students, from our faculty, you guys can put it in the Q&A, you guys can put it in the chat. That's where we're going to be answering your questions today. First one is from your perspective, what's the biggest challenge faculty face today in engaging our diverse group of students? What do you guys think?
Oh, for me, the biggest challenge in engaging is how you engage and implementing that plan for engaging, right? Because what I might see as something that is a good idea, your learners might not see that as a good idea. For instance, when you're going reviewing a syllabus at the beginning of the semester, and so one of the assignments we do, it's called a seminar where we have them present, right, what they learned from the diagnoses. They weren't comfortable with that at first, but again, explaining that rationale of this is why we're doing that. That is a prime example of what you said earlier, Hiva, about the flipped classroom. Okay, because I'm going to take the knowledge that you learned. That means you're going to come prepared, and I'm going to give you feedback and information to clarify any issues in what you've learned and what you presented. And so they were on board. But again, explaining that, right? So that's how you tee up that engagement piece. It's going to take having that conversation. Again, what we're thinking is probably not what they're thinking. So how do we bring that together to come to common ground?
I love that. Rachel, what about you?
I think the biggest thing for me is helping students be responsible for their own learning journey. What I'm finding more and more with the new learner is they don't necessarily want to take full responsibility of their journey. And anyone can do this where it's like, oh, well, this instructor did this, or oh, I had this bad experience, instead of helping them find like full ownership of that educational journey. And so I think that's one of them is like, hey, you have these resources. I'm here to help you use them, but you are ultimately the one responsible for that learning.
Yeah, Jillian Taylor said the biggest challenge I find is getting them to use their resources. So I think a lot of faculty do share that with you, Rachel. One of the biggest challenges that I see in meeting students, I keep wanting to say patients, meeting students with engaging the diverse group of students that we now have is I want to be accessible, but I have to also preserve my own time. And that's really tough
Oh,
when
yes.
you have a mindset of, okay, I need to make sure that I'm engaging with students and making them feel like somebody is here, somebody's supporting them. I'm going to encourage them. But at the same time, we have to be mindful of our own burnout and our own boundaries and make sure that we're being accessible, but not at all hours of the day and at all days of the week. And I think sometimes our students expect that. So that's really challenging, been challenging for me as an educator. And then Stephanie says, agreed, not feeling compelled to purchase every student item
I love that.
advertised on social media. Yes.
I love that.
Yeah, I love it.
I
And
love
I
that.
see it from our students too. They just get bombarded with all this social media. What do I buy? What's going to help me? And I feel like it breaks down their confidence even more because they're just getting overburdened by over information, like too much information, and they lose focus. So I see that a lot. Students kind of lose focus and it really breaks down their confidence. So being that mentor and saying, okay, forget everything else. This is how we're going to focus. This is what you need to do to learn the content and be confident and really help them build that confidence is really tough. Next question. We have two more questions in the Q&A. Let's see. All right, get my Q&A going. So, how have you used reflective journaling in your practice as a nursing faculty? That's from Susan Engel. I love that. Who wants to
Yeah.
start? Has
Oh, I can
anyone used,
start.
let's start with, has
I
anyone used reflective
reflect.
journaling in their
I do.
practice?
I do. It's so important, and asking those open-ended questions. So we had this assignment. How would you apply it to practice? How does this make you feel emotionally? So yes, I use it, and I always get a good response. And I know always is a strong word in academia, but asking those reflective questions really helps them to understand and how to apply this professionally, and many times, especially in the psych world, professionally. So yes, so students don't want to feel like they wasted their money. So I totally get that. I saw that pop up. Yes, so help. Yep. So again, that helps to them to understand, how am I applying this? What is the win-win, right? Because everybody wants to know what's in it for me. So that reflective journaling certainly helps with that. And I make sure I read those, right? And I make comments. I say thank you for that. And then I also say, hey, you brought up this point. So they know that you're listening, right? So it really makes a big difference.
I love that. I think it helps with that connectivity, that engagement, feeling like the faculty member is present. They understand you, they understand the journey you're going through. It's very nice. And someone said, I feel like if we require resources as faculty, we should make sure we use them so students don't feel like they're wasting their money. And there have been time and time where I find that my students are not purchasing the required material. And I ask them, I say, so how are you learning this content? And a lot of it is online. And so I worry a lot about misinformation when they're learning it that way. So not only do we want to be mindful about the required material, but I think also mindful about the cost and those financial strains on our students because they are paying so much for the courses, the education that they're receiving. We really have to be mindful of what we're requiring of them and encourage them to use those resources. Absolutely. Okay, next question for this is an NCLEX question, so I'm going to ask Rachel, how would you approach a student who requests financial assistance for the NCLEX after already receiving full tuition reimbursement and complimentary study materials? At what point does support risk becoming excessive, and how do you define the boundary between helpful guidance and over assistance? I love that.
Yeah, absolutely. That's a great question, Molly. So, what I think is really important is how is the student use what's already been given to them, because that's going to show how they're likely going to use it going forward. So, did that student use those complementary study materials, or did they sit there and they were never opened? What has the student used specific to the NCLEX? Maybe they did have their tuition covered, but they don't have an NCLEX resource. So then it's like, okay, I could see them getting an NCLEX resource. What I think students do, it's like me in the gym. If I buy a gym membership, I'm going to go, right? Like if I spend the money, I'm going to reach my goals, but that's not how it works. Okay. We have to actually utilize the resource. And I think what honestly, our culture has kind of created is the more money you spend, the more you're likely going to get there, especially when it's not your own money, right? Then it gets to where it's like, oh, I'll just ask for this too. So, what I would say is having a one-to-one of like, hey, we've already purchased these resources. We haven't used them. So let's use these resources to benefit your prep. And then if you need something additional, you can go purchase that on your own. Because here's the other thing, as a new grad, they're likely doing some type of work as a new grad nurse that they're making some money. And I think teaching too, like there is a point of responsibility when it comes to your education. Like thinking of my own journey, or a lot of nurses I know, they've had to pay for something along the way. They've never had a full ride completely through nursing school with every resource under the sun covered. And so I think it's important to teach some of that responsibility too, especially if it's a student that might go on for an advanced degree later on. Hiva, Tracy, anything you want to add to that?
Yeah, a student comes to mind recently who I've been tutoring and mentoring, and she received financial assistance through her advanced practice, but she signed up for both boards exams, and the board examinations are not cheap. And what I realize is that students really don't know how to be financially responsible sometimes with the finances that they're given, and they get nervous and they really need that guidance to really understand financial responsibility. Like you don't need to purchase or apply for both boards examinations just to, for those of you who don't know, for advanced practice, for family nurse practitioner, you could sit with the ANP or ANCC. Both are board certifications. And this student had signed up for both. And I'm seeing that as a trend too, with students signing up for both because they're nervous that they're not going to pass with one and they're going to try the other right away. But those courses cost a lot of money. And this particular student had used her financial assistance for applying for both. And then she also was looking for financial assistance with the tutoring that we were offering. So It was definitely a moment where I realized, okay, we need to have these conversations with our students. How are we going to be more financially responsible, especially as you start making more money and pursue more degrees and advance your career as a nurse? We really have to be mindful of how we're spending that money.
Well, they chose to do the yard work while, so I turned my mute up. But I would say just remaining curious and asking questions and the student resources that you have on campus, they might need some help with management. And we talk about social issues. They may be using the money for bills and things like that. So just remaining curious and, asking more questions because sometimes what we think is, maybe misuse, it maybe they're using that money to survive. So,
Yeah.
how can we further help?
100%. Yeah, they're definitely, we really have to come at it with understanding first before teaching. We have to understand
Mhm.
what the background is. I love that. Elise asks, how do you manage the time constraints that come with active learning strategies? I often seem to run out of time. And Elise, that's definitely something that I struggle with too. And when I was putting this webinar together, I was thinking, okay, I don't want this to feel like faculty are like, all right, one more thing I have to do as a faculty member. How can we really be thinking about integrating these active learning strategies that are going to be less of a burden on us and more freeing for us to really get that engagement with our students? And one thing that I can think about is just incorporate one active learning strategy for one session in your coursework. Try it out, see how it goes, and then try to use things that you can replicate in that course moving forward so that you're not continuing to create those active learning strategies over and over again. What about you, Rachel and Dr. Hicks? What do you guys think about those active learning strategies and how can we preserve our time but still incorporate these new strategies that we're learning about?
One
I
thing
think
I like to do, oh, sorry, Dr. Hicks, you go
no,
ahead
no,
first.
no, go ahead, Rachel. You're fine. Go ahead.
So one thing I like to do is after I have implemented one of those strategies is actually assess with the students, did this reach the outcome that I was hoping it to reach? Because if it's not hitting that benefit, then it actually isn't worth spending the time there. For example, flashcards. When I was in school, our instructor required us to write 100 flashcards a week. And do you know what I learned nothing from? Writing 100 flashcards every single week. It took me forever and I didn't get the impact that I needed. So what I like to do if I'm going to implement an active strategy, is it worth the time that is being spent? And if so, how can we replicate it more to where it's not a huge lift every time? And we may find from even class to class that our students respond to it differently. And so it is this constant assessment, just like we would our patients, of how are our students doing with this intervention? Do we need to change that intervention? And just like Kiva said, start small and build as you find what works. It's going to get quicker each course that you are implementing those changes in.
I would certainly agree with everything that's said. And, resource you mentioned earlier, Kiva, was Quality Matters, right? And then NOF, they outline you don't want to have so many objectives that you get overwhelmed, right? So that's why we do our course evaluations at the end of each semester. Is this really a benefit? And really reading what the student feedback is and really taking that to heart and what you need to change and what you need to keep. What's working, what's not working. I know many faculty, my colleagues, they get a little offended. With the evals if the students don't agree with something, but it's okay. We have to be agile. We have to be open to change. And so it's okay because we put a lot of work. So I get it. I'm looking at it from both ends. We put a lot of work into that course. But sometimes we have to really take in and understand that sometimes even though we put in all that work, it just may not work. So just use those evaluations as a guide for yourself. Now, sometimes they can be unreasonable. I get that too, but really looking at them with a realistic lens.
I love that. So that self-reflection, looking at it from a realistic lens and seeing, was it worth the effort, right? Because
Mhm.
oftentimes we do spend a lot of time on these new initiatives, new strategies, and did it actually deliver what we wanted the outcome to be? So I love that. Well, we're at time today, and I really appreciate Dr. Hicks and Rachel for joining and giving us their expert opinions on this topic. It's such an important topic, and we see it a lot from trickling down from administration to state regulations. And really, it's something that we want to be mindful of as our patient demographics are really changing. We want to really reflect that in our nursing population. So the way that Rachel started us off with, we want to make sure that our students can see themselves in leadership roles so that we can build those strong leaders in the future. So I really appreciate you guys joining us today and engaging with us. You can reach out to us. We can put our email addresses in the chat for anybody who wants to reach out. But I will hang on for a few more minutes if anybody has any other questions. But if you're hopping off, thank you again for joining us and have a wonderful rest of your day.